get loud. Everyone is wanting to know what we are saying and what we are thinking. And I'm asking you to get loud with me.
The last 2 years have seen the Ontario Nurses Association being loud and clear on the labour front, in workplaces, at government, and in the public eye.
CCACs are the hub of community health!
2015 began with the largest and one of the most important strikes in the history of ONA. 3,000 ONA members, working for 9 community care access centres, went on a province-wide strike for fairness. For 17 days, our spirited and committed CCAC workers endured the extreme cold and held fast to their beliefs with the solid backing of the ONA members and leadership. Happily, in March, a precedent-setting arbitration award provided wage increases for CCAC staff that were in line with the wage increases of ONA members in other sectors. As ever, ONA has been dedicated to the fight for good public health care. Since 2015, over 1,500 registered nurse positions have been eliminated in Ontario. In the summer of 2016, Ontario was ranked as the worst province in the country with the lowest ratio of RNs to population. Across the province, ONA and our members have been fighting against the elimination of registered nurse positions at their hospitals. ONA members in New Liskeard protested nursing cuts at Timiskaming Hospital. Members at Windsor Regional Hospital have mobilized against the elimination of 169 RN positions, aided by local advertising placed by ONA and lobbying at Queen's Park. ONA members gathered thousands of signatures against the cuts and had them presented to the legislature. Inadequate funding for hospitals put tremendous pressure on collective bargaining in this period, and the Ontario Hospital Association came to the table demanding concessions. However, ONA's Central Hospital negotiating team was able to win, through arbitration, a wage increase significantly higher than other healthcare unions, plus improved benefits and premiums. There was also progress on job security, staffing, and workload issues. Importantly, for nurse practitioner members, ONA secured a provincial wage rate for the first time. In the nursing homes sector, our ONA team has reached a negotiated collective agreement. We held our sector meeting recently, and our members will soon vote on the agreement.
We faced a long list of employer concessions. Some of them were, we had to give up our job security. They wanted our staffing language, give it up. They wanted us to give up professional responsibility. They wanted us to give up many of our health benefits. Not a single thing they proposed would do anything positive for our working lives. There wasn't a single thing to address retention, recruitment, or staff morale. The employers should be embarrassed. They should be shamed. In the end, we kept our job security, we kept our staffing, we kept our professional responsibility, we kept our benefits, and we gave them nothing.
ONA, 72 off.
In 2016, after a hotly contested organizing campaign in Kingston, RNs chose ONA to represent the 200 registered nurses at a new facility formed by the merger of Providence Centre Mental Health Services and St. Mary's of the Lake Hospital. In Sudbury, 186 allied health professionals voted to join our union. Other workplaces organized by ONA in the last 2 years include The past 2 years have been a period of increased awareness and activity for ONA on health and safety in the workplace. Our union has developed several resources to help members make the workplace safer. Thanks to ONA members demanding safer workplaces, independent assessment committees have investigated and recommended changes at Sioux Area Hospital and Humber Regional Hospital. Violence against nursing staff has been an unfortunate theme of the past few years. ONA has lobbied government, negotiated with management, and embarked on public campaigns aided by transit shelter advertising. ONA and its members have worked vigorously to force Brockville Mental Health Centre, the Centre for Addiction and Mental Health, and other employers to improve safety and security conditions for frontline nurses. New legislation which gives benefit coverage to first responders for post-traumatic stress disorder was a positive move by the Ontario government. However, nurses were excluded from coverage. ONA has made its case for the inclusion of nurses and has launched a lobbying campaign to change the legislation. Through legal action and months of negotiation, ONA won a very significant victory for our members' privacy and human rights. The College of Nurses of Ontario will no longer publicly refer to nurses who have recovered or are in recovery from mental illness or addiction as incapacitated. On behalf of nursing students, ONA also successfully lobbied to remove the limit on the number of times a nursing student can write the American National Council Licensure Examination for Registered Nurses, or NCLEX.
Thank you again from the bottoms of our heart. I don't know what we do without you guys.
ONA's pre-budget submission at Queen's Park early in 2016 stated, "The government's action plan to put patients first will not succeed if it does not address the essential role of RNs in the delivery of quality patient care." During the federal election campaign, ONA urged our members to get out and vote. At the Premier's meeting in July 2016, ONA, with the Confederation of Nurses Unions, advocated strongly for a pharmacare plan. 1 in 10 Canadians cannot afford to fill their prescriptions.
What happened?
More cuts at the hospital. 74 registered nurses gone.
ONA got loud with its very effective advertising campaign, which had several phases: radio and TV commercials, newspaper and internet ads, and posters in transit shelters reached huge numbers across Ontario. ONA members' defined benefit pension plan at the Healthcare of Ontario Pension Plan, or HOOP, has been in great shape. As of 2015, its funded position reached 122%, delivered an annual return of 5.12%, and had net assets of $63.9 billion. An important part of ONA's member engagement plan is the annual Leadership Conference, which develops leaders and activists for the future of the union. ONA leaders and staff participated in Nurse Practitioner Week, raising the union's profile amongst nurse practitioners. Nursing Week is always an important opportunity for ONA to connect directly to members in the workplace. ONA colors flew at Pride parades in various communities in 2015 and 2016. The annual Labor Day parades had strong ONA contingents, demonstrating pride and solidarity with all working people. Member engagement will continue to be a major priority for the Ontario Nurses Association into the future with creative grassroots campaigns.